Welcome to this session on nutritional management of anemia. This is Dr. Ali. Anemia is defined as a decrease in the amount of red blood cells, or it is also occurring due to a reduction in the hemoglobin in the blood. It can also be defined as a lowered ability of blood to carry oxygen in the body. In this image, you can see the RBC, hemoglobin, and the heme. RBC gets its red color, which is a pigment. This pigment is nothing but hemoglobin. Hemoglobin contains two components. They are the heme and the globin. So the globin part is the protein and the heme part is the iron-containing component. So the primary function of hemoglobin is to carry oxygen from the lungs to the tissues. When the lung receives the oxygen enters the blood. In the blood, oxygen combines with hemoglobin to form oxyhemoglobin. Oxyhemoglobin is carried by the blood, and when it reaches the tissues and the cells, it releases oxygen. So this is the primary function of hemoglobin. So the oxygen that is carried in the blood is primarily due to hemoglobin. This table shows the prevalence of anemia. So it occurs in all the age groups. In the preschool aged children, 47.4% suffer from anemia. In the school-aged children, it is 25.4%. Among pregnant women, it is the highest, 41.8%. Non-pregnant women, 30.2% are anemic. Among men, it is the lowest, 12.7%. And in the elderly, it is 23.9%. So this map shows the presence of anemia among the preschool-aged children across the globe. Because it is occurring in all the countries, it is called as a public health problem. Those countries that are colored dark have more incidences of anemia when compared to those that are colored light. Let us now see the causes of anemia. Anemia occurs due to blood loss. It also occurs due to decreased red blood cell production or due to increased red blood cell breakdown. Causes of anemia also include the blood that is lost in trauma or due to gastrointestinal bleeding. Causes of decreased production include iron deficiency, a lack of vitamin B12, and folic acid deficiency. Thalassemia and a number of neoplasms of the bone marrow also causes anemia, which is very rare. Causes of increased breakdown include sickle cell anemia and infections like malaria. Now let us see the effect of anemia on human health. Nutritional anemia due to iron and folic acid deficiency is directly or indirectly responsible for about 20% of maternal deaths. Anemia is also a major contributory cause of high incidence of premature births, low birth weight, and perinatal mortality. So let us now see WHO's hemoglobin threshold, below which a person is said to be anemic. So in children up to 5 years of age, hemoglobin has to be 11 gram per dl. And in the adolescent, it should be 12 grams per dl. For adult women, 12 grams. Pregnant women, 11 grams. And for men, it should be 13 grams per dl, below which they are said to be anemic. What are the types of anemia? Anemia can be classified based on the size of the red blood cells and the amount of hemoglobin present in each cell. If the cells are small, it is microcytic anemia. If the RBCs are large, it is macrocytic anemia. And if they are normal sized, it is normocytic anemia. WHO classifies anemia into 3 types. Moderate anemia, if the hemoglobin percentage is between 7 to 10.9. Severe, if the hemoglobin percentage is between 4 to 6.9. And very severe, if it is less than 4%. The symptoms of anemia are: the person feels tired, there is shortness of breath, particularly when they are exercising or when they are walking uphill or upstairs, heart racing or thumping, which is called palpitations. There is weakness or fatigue in the individual and a general malaise. Poor concentration among the students can particularly affect their academic performance. The skin is pale, koilonychia, spoon-shaped nails, heart failure, and pica is very common among anemic individuals. So you can see here the consequences of anemia in an image where there is fatigue, dizziness, tachycardia, the person is pale, and breathlessness. So I told about the spoon-shaped nails. So that is shown in the first image. And in the second image, you can see the comparison of the pale fingers, and the lower portion of the eyelid is very pale in the bottom picture. So this summarizes the various symptoms of anemia. It affects almost all the organs of the individual. So how this can be diagnosed? A full blood count to check the level of hemoglobin in the blood and different types of blood cells is very essential. A blood film test involves looking at the blood under a microscope to check the size and shape of the red blood cells. Levels of vitamin B12, iron, and folate can also be done. Nutritional anemia. Anemia is said to be nutritional anemia if it is caused by absence of any dietary essential that is involved in hemoglobin formation. The nutrients that are associated in the formation of the hemoglobin are iron, folic acid, vitamin B12, pyridoxine, vitamin C, vitamin E, and copper. So let us see the different types of anemia one by one. Iron deficiency anemia. In this type of anemia, iron is necessary for the formation of hemoglobin, as I've told already. 55% of the adult men and 75% of the adult women in the reproductive years are affected by iron deficiency anemia. The causes of iron deficiency anemia include inadequate iron intake due to a poor diet, inadequate utilization of iron due to antagonists in the form of drugs or in the form of tannins, phytates that are present in the food, blood loss due to trauma, menstruation, and increased requirements in pregnancy and adolescence, inadequate absorption of iron due to lack of vitamin C, tannins, and phytates. The next type is the megaloblastic anemia. Vitamin B12 deficiency alters the DNA synthesis that is required for the maturation of RBC. The cells are large and nucleated. Megaloblasts appear in the bone marrow and in the blood circulation. The causes of megaloblastic anemia are due to inadequate intake, like in the vegetarians, and all of us know that the vitamin B12 is present only in the non-vegetarian foods. Inadequate absorption and utilization due to the absence of intrinsic factor. The vitamin B12 that is present in the food is called as the extrinsic factor. And we need a factor called as the intrinsic factor, which is synthesized in the body for the absorption of the extrinsic factor. And inadequate utilization due to the presence of antagonist and increased requirement as in infancy or pregnancy. Folic acid deficiency can also cause anemia. Folate deficiency is associated with malnutrition, infection, and also pregnancy. The causes of folate deficiency include poor dietary intake, low absorption, increased requirement as in pregnancy, infestation and infection like malaria or hookworm infestation, and due to drugs like oral contraceptives depends on the type, cause, and severity of the condition. Treatments may include dietary changes or supplements, medicines, procedures, or surgery to treat blood loss. Medicines can be used as in the form of antibiotics to treat if there are any infections, hormones to treat heavy menstrual bleeding in teenage and adult women, medicines to prevent the body's immune system from destroying its own red blood cells. Blood transfusion is also a treatment option for anemia. A blood transfusion is a safe, common procedure in which blood is given through an intravenous line in one of the blood vessels. Transfusions require careful matching of donated blood with the recipient's blood. This is done only in severe anemia or during a surgery in an anemic individual. Blood and marrow stem transplant. A blood and marrow stem transplant replaces faulty stem cells with healthy ones from another person who is nothing but a donor. Stem cells are made in the bone marrow, as all of you know. They develop into red and white blood cells and also platelets. During the transplant, which is like a blood transfusion, stem cells are donated through a tube placed in a vein in the chest. Once the stem cells are in the body, they travel to the bone marrow and begin making new blood cells. Surgery. If there is a serious or life-threatening bleeding that causes anemia, a surgery is needed. For example, a surgery is needed to control ongoing bleeding due to a stomach ulcer or colon cancer. So here I have listed all the iron-rich foods that can prevent anemia and that can also be consumed for treating anemia. So most of the green leafy vegetables are rich in iron. So you can see here that cauliflower leaves have the highest amount of iron, and also certain cereal products such as the rice flakes contain iron. So you can see here rice flakes contain 20 milligrams of iron per 100 grams. So these are some of the iron-rich foods. Dry grapes, or which are called as the raisins, dates, figs, and the green leafy vegetables. All the green leafy vegetables contain iron. Rice flakes, liver, and the animal foods are also a rich source of iron. Animal foods give iron that are highly bioavailable. So these are again iron-rich foods. Watermelon and custard apple, jaggery, they contain some amount of iron. So these are some of the vitamin B12 rich foods. So vitamin B12, as I said already, is rich in non-vegetarian foods. They are present only in the non-vegetarian foods. So the vegetarians don't have to worry because B12 can be synthesized by our own body. So we will get enough amount of vitamin B12 from the body, from the microbiota that is capable of synthesizing vitamin B12. So these are the animal foods that are rich in vitamin B12. Folic acid is particularly rich in green leafy vegetables, the nuts and the grains. So here you can see all the foods that are rich in folic acid. And coming to diet therapy, when a person is anemic, what he or she should do to overcome anemia? The first step is the person should consume a balanced diet. Include whole grain cereals, especially millets. Relish green leafy vegetables. Include fruits and vegetables. Include vitamin C as much as possible along with iron-rich foods. Avoid consuming coffee or tea along with meals because the coffee or tea contain tannins which can combine with iron and make the iron unavailable from the food. Weaning food should be incorporated to the children, and the weaning food should contain iron-rich foods like the green leafy vegetables. Promote the growth of kitchen garden. Cook in iron pans wherever possible or iron tawa, and use iron ladders because this can incorporate little bit of iron into our food. Use iron fortified salt. 1 gram of salt contains 1 milligram of iron. Deworming is very essential for the anemic individuals because hookworm infestation can cause anemia. So hookworm infestation occurs due to unhygienic environment, due to lack of personal hygiene, and when people walk barefoot. The hookworm contains both iron and iodine. This is available in Tamil Nadu and it is supplied for the Anganwadi centers where the noon meal is provided for the children. The food prepared in these centers uses this double fortified salt which contains both iron and iodine. So this is the iron fortified salt. Thank you all. And I dedicate this presentation to our founder.